Hello, my name is Retzius-sparing. I'm a urology consultant specializing in robotic surgery, and today I'll walk you through a treatment called robotic-assisted radical prostatectomy, commonly used for prostate cancer. Let's start with what that means and who is it for. A radical prostatectomy is a surgery to remove the prostate gland and some of the surrounding tissue, usually to treat prostate cancer. The goal is to remove the cancer completely while keeping as much normal function as possible. When we use robotic assistance, this advanced technology helps surgeons perform the operation with precision, making smaller cuts and quicker recovery for our patients. Radical prostatectomy is generally recommended for men with localized prostate cancer. That means when the cancer hasn't spread beyond the prostate. Factors like the stage of the cancer, overall health, age, and personal preferences of the patient all play a role in determining if the surgery is right for you. In the past, prostatectomy was typically done through open surgery, which involved a large cut to access the prostate. However, today most prostatectomies are done using robotic assistance. This technique allows for smaller incisions, less pain, and faster recovery. There are also different approaches when performing robotic-assisted prostatectomy. One is the traditional anterior approach, where the prostate is accessed from the front. Another is the Retzius-sparing approach, where the prostate is accessed from behind the bladder. This technique helps preserve key structures involved in urinary control and reduces the risk of incontinence. On the day of surgery, you'll arrive at the hospital, meet the surgical team, and receive general anesthesia, so you'll be fully asleep during the procedure. The surgery typically lasts 2 hours. The surgeon uses a robotic system to make small cuts and remove the prostate with precision, aiming to protect the nerves that control erections and bladder function. After surgery, you'll wake up in recovery and may go home on the same day or stay in for one night. You will wake up in recovery with a catheter, which will be in place for about a week. This will help with the healing process around where the prostate was. You will be given all the instructions needed for a smooth recovery at home, plus who to contact if you have any issues.
Hi, I'm Maria, a prostate clinical nurse specialist. I'm here to support you through every step of your prostate cancer journey, from diagnosis to treatment and recovery. A prostate clinical nurse specialist role is to provide personalized care, answer any questions you may have, and ensure you feel informed and supported throughout the process. Like all surgeries, radical prostatectomy has risks. These include infection, bleeding, blood clots, and in rare cases, injury to nearby organs. However, with robotic assistance, we aim to reduce these risks by enhancing surgical precision. Some side effects are temporary, while others can be longer lasting. You may experience urinary incontinence or difficulty controlling your bladder, which usually improves over time. Erectile dysfunction is another potential effect, as the nerves responsible for erections are located near the prostate. However, nerve-sparing techniques in robotic surgery can help preserve some sexual function. Rehabilitation and pelvic floor exercises can speed up recovery, and your healthcare team will support you throughout this process.
In summary, robotic-assisted radical prostatectomy is a highly effective treatment for prostate cancer, offering a quicker recovery and fewer side effects compared to traditional methods.
If you are considering this surgery, consult with your healthcare provider to see if it's right for you. Thank you for watching.